Well. Good afternoon. It is so exciting to be here with you this afternoon. We'd like to welcome you to the 31st, number 31, Flint Community Webinar on Coronavirus this beautiful October day. It is just such a delight to be here. And for those of you that joined us, and maybe you joined us by YouTube, you see us kind of rocking here, along with the music that says, we're going to change this world together. And I trust that is why we all come on the webinar every week, to make sure that we get the information that's being provided by our various community partners to ensure that we have what we need to make a difference in the world. All of our community partners, we can't express enough our appreciation for them being a part of this event each week. And for those of you that have joined us, please remember that you can put questions in. Our partners are definitely here on the webinar to answer any questions that you might have. So as we're moving through the webinar today, please feel free to put your questions into the queue. This community webinar is being brought to you by the Healthy Flint Research Coordinating Center, which is a multidisciplinary partnership with community and academic partners working together to make sure that we can figure out how we can merge our collective disciplines to ensure that the community, those of you that are listening and those that we serve, can really benefit from all of the work that we're doing together. We want to remind you that you can put questions in the queue and then give us a call if you are listening and you can't see exactly everything that we're doing, but you have a question or an inquiry. Please give us a call at 810-830. Now watch you get the phone number wrong. 835-2130. Again, that number is 810-835-2130, and we will be happy to get your questions in and answer those questions for you. Today we have a very exciting a day for you today. A number of things have happened in the last week, and we want to make sure that you are up to speed on what's happening. Last week, from the comments that came in, there were a number of questions about our youth, about how they're dealing with the COVID, what's available for them in this time, in addition to an update on the rapid response initiative that was going forward. And we also have an update for you from the Flint Community Schools today, and some more information about voting. So we want you to stay tuned. For those of you that can, you might want to get your pencils out. We do have these webinars up for you to review after the session, but you may want to take some notes today to ensure that you have everything that you need immediately following. And we also have the governor's office. So let's get right into our conversation today. We're going to start obviously with something I know that you're all interested in, and that's what's going on with this rapid response. Isaiah Oliver is here with us today, and he is the CEO of the Community Foundation of Greater Flint, and we're going to hear from Isaiah this morning. Isaiah, what's the good news?
CEO of something. He's
somebody. He's somebody. Thanks, Isaiah,
man,
for coming on. I know you're busy, and I know we want to make sure we can get you on. So,
no, thank you so much for the opportunity to be here and to give you all a bit of an update. The team has been working really hard, and I'm just thankful, one, to you all, because we received like $5.7 million in requests in a 1 week period. And we were worried about not getting the word out, not getting information to the right people. And you all helped us so much in getting the information into the hands of individuals and groups that could do this work and do it fast. And so we closed off applications coming into the foundation on last Friday at 5 p.m. We got a couple 502s and 515s that were read through and seen and reviewed. The reviews happened over the weekend by a group of individuals that represented folks from municipal government and state government, grassroots organizations, the city of Flint, the philanthropic organizations, health institutions, transportation related. I mean, we had a great mix of folks reviewing these proposals. They brought final reviews into the foundation via a 4-hour session on this past Wednesday. 33 recommendations were made for $994,000. They are pending some approval through our partners at the Michigan Public Health Institute and the State of Michigan Office of the Department of Health and Human Services. And once we get those through, we will have announcements out to individual groups to start doing work between now and December 30th. There is another part of this process that was for Greater Flint Urgent Relief Fund funded projects that we're going to, I'm sorry, that is there. I'll probably move right ahead of this slide, so I apologize in advance. But we've moved on to doing some review with the Greater Flint Urgent Relief Fund Committee. They will be rolling out announcements on the 23rd, which is next week, Friday. And at that point, we will have what will be like $1.925 million already announced. And we're working very closely again with the Chamber on unfunded Black-owned business support grants that they've been working through for most of this COVID season that we've been in. And so lots of work already happening, but we did want to come back to you all and give you an update on what we've been doing. Again, $94,000 in grants have been recommended through a process that engaged a multi-sector group of committee reviewers, and then another $1 million in proposals will be brought forth through the Greater Flint Urgent Relief Fund by this next coming Friday, with another $250,000 working with the Chamber for Black-owned businesses. And so lots of work happening, open to questions, and I think I have Moses Bingham also on the line to answer additional questions. He's been both feeding in almost headfirst into this work over the last week and a half.
Isaiah, just a couple quick questions, and
Please.
thank you so much. I know that you guys are working really hard and this is a new process, and just so that our community members can really get a sense of the different layers, as this is federal dollars now that we're dealing with that's coming through the state. So where it was a little bit more maybe prompt because you were able to do it quickly, you mentioned several approval processes that have to happen before actually the grants can be awarded. So what should people be expecting?
I'll tell you. So thank you for that. I appreciate that. And the generosity that came with the way you shared that information. This is not our traditional philanthropic set of resources. This is not private philanthropic dollars that we have the guidelines all up front. We know what the donor wants to see happen, and we're moving through a process as a result. This is us learning how to get state and federal resources onto the ground in a community, or to community members that typically don't have access to those resources and don't understand the process by which you spend them. And so for us, we did an initial review that was a group of community members, again, a multi-sector group that did a review of the proposals. And they're offering a set of recommendations to me at the Community Foundation, where we're going to work with the state of Michigan to ensure that it aligns to all of the criteria. Some people would describe it as red tape associated with accepting federal dollars. The first announcement has already hit mailboxes. So 33 organizations in our community have an inbox saying that your proposal was reviewed and recommended to funding to the Community Foundation of Greater Flint, pending subsequent approvals by the state of Michigan for the federal resources that we're using. And so those emails have already gone out. Folks should also know by Monday, let me see this, by Tuesday morning, because on Monday we're going to be having conversations with the state of Michigan about that second level of approval or due diligence on the organizations that we've approved. I hope that answers your question.
That does, because again, we're used to your process. so we got to figure out, it's a steep learning curve for all of us. And I think that's something that's important, especially for organizations that this may be their first effort, just to stay in the process and let's learn together how we can make a difference. So again, changing the world one little piece at a time. So thank you.
No, thank you. I'll tell you, I've been talking to my staff about this quite a bit, and I would encourage our community members to maybe adopt this ideology. This is a tough time. And so when things get difficult, turn to wonder as opposed to turning to judgment. I wonder why they had to operate this way. I wonder why this is the guidelines. I wonder why it's taking so long, as opposed to an indictment of the process. We're learning this. We're excited about the opportunity that it presents, not only now, but in the future. But again, if you could just offer a little bit of generosity in the process, we're excited about getting what will be $2.5 million into the hands of community residents that know exactly what to do with those resources.
So now, Isaiah, I know you mentioned that Moses Bingham is on the line as well. I do see him here, and he's going to be the primary point of contact. But would you say that if people have questions about the process, who engaged in it, and still want to learn a bit more, that they should definitely be in touch with Moses?
They should be in touch with Moses. His email address is there. If you call him, it'll go to his phone, but I'm telling you, he's trying to field so many calls right now. How much more we can pour on him. But yes, Moses is the best contact for this particular process. We have a machine working behind the scenes to make this happen. Sue Peters and Stephanie Whitledge and Becky Salter, tons of folks that are behind the scenes making sure this project works.
So thank you so much, Isaiah. I appreciate you taking the time out to be with us this afternoon. Just quickly, Moses, a comment, and before we move on. All righty, thank you. Well, we'll know. That moment went by really quick. So please, if you have additional questions about this process, Moses Bingham is the gentleman that you need to talk to. His email address for those of you that are listening is mbingham, MBINGHAM @cfgf.org. That's Community Foundation of Greater Flint.org. And so we thank Greater Flint for being here for us.
Now, I'll tell you, I will be here for at least the next 15 minutes or so. And so if there are any questions that pop up in the chat, I'll be responsive to those questions if you don't mind.
Thank you so much. I appreciate that. So those of you that are listening, get those questions in. This is a good time to get the answer right from the CEO of the Community Foundation of Greater Flint. Thank you, Isaiah.
Thank you.
So we know that Flint is on the move, and Dr. Reynolds has been just an extraordinary support for us as the Chief Public Health Advisor for the City of Flint. And he has also made us aware that this young lady is extremely able to answer questions for us, Billy Mitchell. And so we're going to talk to Billy Mitchell for the next few minutes. Billy, we know that there are some continuing efforts made by the City of Flint to ensure the health and safety of the Flint community. Can you give us an update on some of the important things that you are working on right now?
Yes, good morning, everyone, or good afternoon. And so I did want to let everyone know we're still doing our Tier 1 testing. And so if a City of Flint employee knocks on your door, or if you find a note on your door asking to get your water tested, we would love for you to have your water tested, please. If you wanted to get your water tested, if you know that you are one of the addresses that may possibly have lead lines still, you can call us at 810-410-2020, and we'll be sure to get your water tested. And also that leads me right into the opt-in form. If you have not opted in to get your lead lines replaced or your lines checked for lead lines, you can still do that by going to our website at cityofflint.com, and you can fill out the opt-in form there, or you can come down to Flint City Hall, located at 1101 South Saginaw Street, downtown Flint in Flint, Michigan. Or you can call me and I can guide you through the process. It's very simple. My number is 810-237-2044, and I can also take your opt-in form down to row myself. City of Flint is still having water filters, water test kits, recycling bags, and mattress bags. We're giving those away still at our information counter, again at Flint City Hall. And now to voting, last but definitely not least. You can still do your absentee ballot voting Monday through Friday, Flint City Hall, 8 a.m. to 5 p.m. Through November 3rd. You can also vote on October 17th, October 18th, October 25th, and October 31st, as well as November 1st, 9 a.m. to 5 p.m. Those are additional dates and times that the office will be open for your convenience to come in and do your absentee voting. And if you don't know where you're supposed to vote, you can go to cityofflint.com and get your voting locations. Bring a friend with you. It's very important that you get down there and let your voice be heard. And on
if we could go back one slide, I just wanted to re-emphasize one more, Tay, if you could, please, because the ways that people can vote, if we can just talk about this real quickly, Billy, because there are people who already have their absentee ballot. We want them to get that absentee ballot completed and get it.
Uh-oh, I'm not. Oh. Is that a bomb?
Did I lose you?
Yeah, I think so.
Okay, I'm so sorry. Can we now?
I can hear you. You keep going. I'll just turn my video and audio on and just be ready to jump in. So if I start talking, that means we can't hear you.
Thank you.
No problem.
All right, perfect. All right, so we just want to make sure that people, if you have your absentee ballot, get that absentee ballot completed. And now let's go to that last slide, Tay, where it talks about the ballot boxes. Can you talk a little bit about this for us, Billy?
And
The
so
ballot box locations.
there are ballot boxes. They are brown, and they have the wording on it to let you know that they are only for your ballots, and they're placed around the city that people can have you know, easier access to voting if they can't get down to City Hall. So those different ballot box locations are located at Burston Fieldhouse, which is on North Saginaw, and on the south side at Word of Life Ministries, which is 460 West Atherton Road. On the east side of Flint at Mintz Manor, which is 3820 Richfield Road, in the lobby. And then on the west side of Flint, we have a ballot box at West Court Street United Methodist Church. The address for there is 2920 West Court Street. And if you have any questions, you can always contact 766-7414. That is the number for the clerk's office. And Billy is always available. You can call me at 2044. And I don't mean that I'm never busy, but I mean, I will get back with you and I will get you your answers. So again, I'm 237-2044, the clerk's office, 810-766-7414. So thank you.
Thank you, Billy. And it's just this last reminder. We want to make sure, if we go to the next slide, make sure that you vote. This is an incredibly important time for all of us. It's not just the presidential election, but it's all across our communities, our county, the state, and then the federal. So check your status. You know, some people are not sure, as Billy said, where they should go to vote, but check and make sure you're at the right place and get that information. And Dr. Deborah says this best. She says, plan your vote and vote your plan. And that's really, really important. And let's all do that. Let's vote early. We've seen lines and lines. So vote early and support others. Billy, anything else you want to tell us about this process, that as a city official, how incredibly important this is for us right now?
I think it's important if you check and see who are not only running for your president, but you check your local elections, your state elections, check everyone and look into who you're voting for and make sure they align with what you believe in. And, look at everybody, because some people are surprised that certain offices are running. They don't know, but if you plan your vote, you'll know. So go ahead and make sure you look into everyone that's on the ballot this year.
Okay, thank you so much. There is one more thing we want to talk about in terms of our voices counting. And yesterday was the last day for census count. We know we were trying to get them to push it to October 31st, but it ended on yesterday. So we want to certainly thank our community for doing a great job. As I said, it's over, we did it. Based upon the information that we received, we hit some historic rates this year. We'll have that information specifically in a couple of weeks to know just how we ended up with the census, but thank you so much. And we just want to say congratulations and good job to the Flint, Genesee County community for the work that you have done, helping to get a complete count for the city of Flint. And again, all of these things are so extremely important. We can't express enough to you how important your voice is. So let's continue to do this work together. Our city, our county is ready to give us an update. Genesee County Health Department, Suzanne Kupel is on the Zoom on this video today, and she is going to help us to know what we are doing as it relates to our the COVID response. Suzanne, we talked about this a little bit earlier. We know things are shifting, and they're not shifting in a positive direction. And so this whole idea we talked about last week of contact tracing is still extremely important. Can you just give us a quick update on what's going on with contact tracing?
So just a reminder for everyone, when someone tests positive for COVID-19, we want to interrupt or break the chain of transmission to other individuals in our community. So the idea is that each individual case of COVID-19 is thoroughly investigated. They do interviews with that individual, and they find out who that individual was in contact with during the time they would be contagious. They reach out to those contacts to let them know about their potential exposure. They provide health education and resources to that individual to prevent them from then spreading the disease to the next individual that they've been in contact with. So it's critically important that we break the chain, that when we find out somebody is positive, we connect with them, we find out who they were engaged with, and then they can then quarantine, stay at home, and they are protected for that 14-day time frame, so they're not exposing anybody else. That encourages people to the opportunity to get tested, communicate with their healthcare provider, but it's critically important that we break the chain. And you see on the slide, it says the domino effect. In essence, if we don't do that, then those individuals go on to infect somebody else, who then goes on to infect another person, and that's where we get the widespread COVID-19 spreading of the disease. So again, break the chain of transmission. The other thing to emphasize to everyone is how important these preventive measures are. We know that wearing a mask is helpful in preventing the spread of the disease. We know that social distancing is critically important. Washing our hands frequently, using hand sanitizers if we don't have hand washing available, making sure we're washing frequently touched surfaces. All of these things are critically important. We want to keep the economy moving forward. We want to keep all of the opportunities that we have available in our community. And the way to do that safely is to take these preventive measures. So please get your hand washing in, make sure you've got your hand sanitizers, mask up, and do all the things that we ask of you. The reason why this is so important is because our numbers are not headed in the right direction. As of yesterday, we posted 4,868 positive COVID-19 test results, with 292 deaths. So we're starting to see an increase in deaths again. Our positivity rate is 6.5. The only way we bring those numbers down is by wearing a mask, social distancing, washing our hands, and doing all the things that we continue to talk about on a regular basis. We're also entering into a holiday season. So this is a time to plan for how you are going to interact with friends and family during the holidays, and finding opportunities for alternatives like virtual Thanksgiving. All of those things are critically important. This is also the time of year that we promote getting a flu shot, and this year is so critically important. We have 2 respiratory illnesses at the same time in our community. So getting a flu shot helps protect you and your immunity for the flu. Is another measure that we can do, along with everything else we talk about, with eating well and exercising and making sure that you're taking care of your health and mentally and physically, getting all the appropriate health screenings, and getting your immunizations. So critically important, you get the flu shot this year. And then the other thing that we think is so critically important is that you have a plan. So know what you're going to do this holiday season. Communicate with friends and family, find alternatives. We've talked a little bit about Halloween. There are lots of alternative suggestions for Halloween activities posted to our website. Again, our website is www.gchd.us. Reminder that we post to our website every day by 2 p.m. the latest COVID-19 numbers in our community. They're there for anyone who'd like to see them. And we also have other helpful information that's available on our website.
Thank you, Suzanne. Did we talk about the testing sites and I missed it?
We have not. So let's talk
Okay.
about the testing locations. And a reminder to everyone that these are open to both adults and to children. They are PCR tests. So this is the preferred test. And I know that many of our schools are trying to encourage parents to be mindful about which test they get. So all of the locations that we are talking about provide that PCR test. So we have Word of Life, Bethel United Methodist Church, Macedonius Baptist Church. Again, all of these are the oral swab. So you don't want to eat or drink, use tobacco products, or chew gum for half an hour before you go. A reminder that the appointments are strongly encouraged, but if someone comes, they will be accommodated. All of these sites have been reviewed and had site visits, so they're all ADA compliant, and there are translation services that are available. We also continue to have testing available at the Rite Aids in Swartz Creek and in the city of Flint, and Hamilton Community Health Network continues to offer the testing at their North Point Clinic and at the Burton Fire Station at the corner of Bristol and South Saginaw in Burton. So all of those locations are available. There's plenty of tests available in our community. Please take advantage of them.
Thank you so much, Suzanne. And I know that these rates are a little bit concerning for all of us. And I'm happy to know that you're going to be working closely with MSU to make sure we can get some real understanding about this data so that we're better able and equipped to respond to them. So just again, that's an encouragement. Let's be sure that we take the necessary precautions. We're going to, in a moment, talk a little bit of the importance of vaccines, especially for our children. So we want to thank you, Suzanne, for all that you are doing at the health department and the team there. We have with us this afternoon the Assistant Superintendent of Flint Community Schools, Kevlin Jones, or Kevlin B. Jones II. We're excited that you're here with us this afternoon because we know that many have questions about what's going on in the school system, and we appreciate you coming today to give us an update.
Absolutely. How you doing today?
I'm good. It's good to see you.
Good. Same here. So first, happy Bosses Day to all the bosses out there. Thank you for all you do for all the folks that work under you. So just to kind of give you an update, we're continuing to forge forward. We are definitely depending on our health community to support us in making our decisions. And so right now what Flint Community Schools is focused on is calling all of our families one by one to ensure that they want to stay virtual or they want to continue the distance learning. There's a difference between the two. And many of our families, we're finding they do not know the difference. And so we want to get the word out that the difference between distance learning and virtual learning is that distance learning is being online face-to-face with your teacher every single day. And we do know that the best way to educate our scholars is to have them in the classroom. But the second best way, if we can't do that, is to have them face-to-face with the teacher. So that option is there. But we're calling to find out if our families can continue the distance learning, or do they want to go with virtual learning, meaning that the teacher records lessons and put it into the Google Classroom, and at the parents' leisure or time that they have when they're not working, they work with their child with that work, and they have a two-way communication with the teacher twice a week to ensure that the child is being educated properly and getting their work in. And why are we doing that? Because we're not so sure when we're going to return face-to-face. We've been watching what's going on with the governor and the appeal that was denied. And so as a school community, we are listening to our health community. We're also listening to what's going on with our governor and her executive orders. We want to be safe. We want to make sure that we are following the proper guidelines. And so what we are reaching out to families to find out is if you still want your child to be in distance learning or virtual learning. And if not, we are preparing ourselves to have face-to-face learning in some capacity. And we are focusing our attention on the most vulnerable, which would be our younger babies, our younger scholars up to second grade. And so if we have the choice to bring them in slowly, we are going to scaffold in that way and start with our younger babies and our most vulnerable with our LSS scholars as well. And so we're continuing to offer lunch and breakfast to our families in our buildings. They come by from 10 to 1 and pick those meals up. We're continuing to support the social, emotional aspects of our scholars. We have breakout rooms with our social workers, our behavior specialists, if needed, and we also have our parent university that's going on with our parent facilitators. And so we're continuing to do all we can in this climate. Like Isaiah was saying earlier, it is a difficult time. Our parents are learning as well. They're being teachers, and we appreciate you. We appreciate all you're doing. And so we're relying on our health community, and they have been communicating with Flint Community Schools every week. And so I'd just like to thank Dr. Furholden, Dr. Reyes, Dr. Reynolds, and all the work that they're doing to support us, and even our own Eileen Tomasi, who's been very supportive. The cases are rising. Yes, we're having cases with our adults. It's not coming from the buildings, but it's happening out there. And so we're watching it, and we're just listening to the health community. And so those are our updates as of right now. Any questions for me?
Thank you so much. It's really, really important. Well, I got a question for you. Yeah, I do have a question for you, and I hope you.
Uh-oh.
I know she's frozen with a beautiful smile on her face.
Right. She look like she about to sing something.
I know. So Carolyn, you're gonna have to hold tight.
Okay.
Because, and we've had a bunch of folks jump on the YouTube live because they were not able to maintain a good internet connection. So if you don't mind, just hold tight, and we'll let our wonderful moderator come back to you. Okay?
No
Is there
problem.
anything else you wanted to share?
No, that's what I wanted to share. I wanted to make sure our parents understood what our purpose was right now and what we're doing to ensure we connect with them.
Yeah, and it was cool to talk to the superintendent, who I think we all agree we want to get kids back in school.
Absolutely.
And we got like the best resources that we have to bear to make sure that we do that in a way that's safe and with a solid plan in place. So
Absolutely.
appreciate you, Assistant Superintendent and the Superintendent for allowing us to be partners with you in that work.
Absolutely. Thank you for the opportunity.
Okay, great. All right, just stand by. Okay, Tay, let's keep it going. Okay, we're going to hear now from Dr. Susan Wolford, who's one of our co-directors on the Healthy Flint Research Coordinating Center. Dr. Wolford, I think you're going to be talking about vaccines and some other important things today. So I'm going to hand it over to you.
Thank you so much, Dr. Verholden. So it's my pleasure to be here today. And Yvonne, our great moderator, told me she had lots of questions for me on vaccines. And so I am now going to just try to think of what those questions were about. And
I'm going to ask you a couple. I know this question comes up a lot. So people, clearly we're entering into flu season. Can you tell us if people don't get the flu vaccine, does that put them at greater risk for COVID? Should they be getting them both? Like what should people know about the confluence of flu and COVID?
Absolutely. So right now, we are going into the period where we'll be more open to or more likely to get a flu. And what we don't want is that people are getting flu and we're having to address that in the healthcare system, and people are getting COVID. Now, whereas we have no vaccine for COVID at the moment, and in fact, the trials that were on the way, at least 2 of them are paused at the moment in the US. We do have the vaccine for the flu. And so we are definitely recommending that everybody get the flu vaccine. Children in particular, they'll be going, some of them will be in person in school. They need to get the vaccine, but all of us need to do that, particularly this year. It looks like we've got our moderator back. I see Yvonne, you're there.
I am. I don't know what happened to show. We had a problem on this end and we got totally kicked out. But thanks, Dr. Deborah, for keeping it going. And Dr. Wolford, you were right there talking about no known vaccine. But I don't know if you've already talked about the importance of us utilizing the vaccines that we do know and how they are beneficial.
Well, that's a great point. So Dr. Verholden had brought up the issue of the flu vaccine, which is one of the vaccines that we have and we know about and we should use. But in children, there are a host of other vaccines as well. And in the same way that we are concerned about COVID and we are waiting eagerly for a vaccine to come out so it could help us in the fight against COVID, there are other illnesses out there that we don't see as much now because science was able to come up with vaccines that are so effective. And these vaccines were tested very well and have been used for decades and have been shown to be safe. And they are protecting us, because most of us have received them already. They are protecting us and they're protecting our children from some very deadly things. Different forms of meningitis, from infections such as pertussis, which is deadly in young children. And so we want to be sure that children get those vaccines. So while there's a lot of focus on COVID right now, as there should be, we mustn't forget to protect our children and those who can't get the vaccine because, for example, they might be immunocompromised, by getting everyone up to date on their vaccines.
Thank you, Dr. Wolford. I appreciate that insight that you provided for us. And again, hate that missed that few seconds, but wanted to also see if there was a bit of conversation about during this holiday season, and this links the coming holiday season, linking to what our assistant superintendent was sharing with us before about the desire to bring children back into the school system, how important this is, especially for those who are vulnerable.
No, absolutely. I think we're entering, for one thing, we've been dealing with the pandemic for many, many months, right? So people are beginning to get tired of having to do the things that we know we need to do to protect ourselves. Part of that being social distancing, right? And so that is causing people to sort of wane in the rigor with which they stick to these plans. Also, we see that, oh, well, like the president got COVID and he was treated, and so maybe we can all get treated and maybe it's not such a big deal. Maybe we can just all go about our lives. We really can't, because the things that he got are not things that are available to the rest of us, right? For example, he got the monoclonal antibodies, which just means it's one type of antibody, and he got a cocktail of them that are only available in clinical trials, that he had to get a special exemption to be able to use it outside of a clinical trial. Well, you know, the rest of us are not going to be getting that. So these options, and we don't even know exactly how effective that is because it's still in a clinical trial, but it does seem promising. He also got an antiviral, remdesivir, which is promising, but doesn't seem like it works that well by itself. Regardless, again, very expensive and not available to most of us. And so there is no one treatment that's going to knock this out. There are no vaccines. So we have for COVID. So we have to be sure that while we enter into the season, when people want to get together, we want to socialize for Thanksgiving, we want to socialize for Christmas or whatever holiday is that we celebrate. We want to be together, but we have to remember we must still protect ourselves. So we must get our flu vaccines so we don't spread flu during that time. We must wear our masks, as has been said. We have to wash our hands. We have to make sure we keep at a distance. And we have to keep our immune system healthy, because we will not be getting this extra help for our immune system that's available, you know, in certain circumstances, but it won't be available widely.
Dr. Wolford, I have a quick question for you, because I'm concerned that a lot of people have seen the experience of our president and may potentially underestimate it. I point to the example of Chris Christie, who was very open and forthcoming that he spent 7 days battling COVID in the intensive care unit. It's my understanding also that the president is on steroids. And given the fact that he's 74 or almost 74 and receiving all of these therapeutics plus steroids, is it possible that the steroids are in some respects suppressing some of the symptoms that he might be experiencing during COVID, giving the appearance that he's doing potentially better than he is?
Oh, absolutely. I actually think the thing that probably worked the most for him were those monoclonal antibodies. Those probably worked the best. And the combination of that with the remdesivir probably really helped. And in fact, now the steroids, we know that steroids help, but most people, when they get steroids, they're not getting it at the beginning of the infection, because that's not the time when you really need to give it. It's if it's severe and your immune system is working too much now and is beginning to damage your organs, then the steroids are helpful then. There is no doubt that the fact that he is doing as well as he is now, assuming he had COVID, the reason he's doing well now is because of the treatments that he got. And the vast majority of us will not get those treatments. And so we have people like Chris Christie, who was hospitalized for 6 days fighting for it. And many people, we focus a lot on the death, which is of course very important and awful and just tragic. Also, those who survive it, but have long-term problems, long-term effects of COVID. Their lungs are not the same. Their endurance is not the same. They have so many symptoms as a result afterwards. We have to really work hard at avoiding getting it.
Yeah, so people shouldn't be misled to think that this is no big deal.
Nope. And there's a lot of work out there to try to mislead us to think that it's okay, just get it and you'll get over it. That is not the case. The science suggests that if we just let that happen and we just let everybody just go out there and try and get it, that we will get millions of deaths that were not necessary.
I saw the estimates that said in Michigan alone, if we went to this concept of herd immunity, i.e. 70 or 80% of the population just getting it, it would result in an additional 30,000 deaths just in the state of Michigan alone.
There we have it.
And that's above and beyond what we can expect at the rate that we're at right now. So just thanks for sharing that. I want to make sure that people really understand we've got a physician here every week to help us. You and Dr. Reynolds really understand medically. This is not trivial.
Absolutely not. It is very serious. We must remember that, and we must not tire in well-doing. Keep up the masks, keep up the social distancing, keep up the washing of hands, and do everything you can to keep your immune system healthy. I'm drinking more water than I've ever had before. Keep healthy.
Thank you, Dr. Wolford and Dr. Deb. And actually, to help us with this, as you mentioned, physicians being involved, in a couple of weeks, we're going to have representation from all 3 of our hospitals to help us to work through some of this as well. So please stay tuned, and appreciation to all of the community health workers and the navigators who are talking to our families. Please share this information with them and help them to understand that we're still in a serious situation and we all need to work together to change the course of things. So thank you, Dr. Wolford. I think you answered kind of the question that I was going to pose for Assistant Superintendent Jones. So I want to move now to talk about another really important issue with respect to our youth that came up from our last webinar about the mental health for our youth and young adults. And so happy today to have back with us Katie Baxter from the Genesee Health System, who was the Senior Director of Clinical Services, to give us some insights on what we can do, what can we expect, and how we can address the issue of mental health for our children during this time. Katie.
Well, thank you so much, Yvonne, for moderating and doing such a good job. I love your enthusiasm, and it's always wonderful to be a partner here to with your other guests and learn about all the wonderful things that people are doing in the community educating and all the services that are being provided. It's so important. And so I'm happy to be here. Thank you. So I wanted to talk a little bit about last time in the webinar, there were some questions again about children. And of course, we're concerned about our children, and some children are going in person to school. Some children are not in person and are learning virtually. But regardless, it has been very difficult for all of us during this time and this pandemic. So I wanted to talk a little bit of the effects of the pandemic on children, and also what kinds of things we can do to help our children get through this time. So some of the things that influence how well children do and how they're impacted is being confined a lot at home is difficult for anyone. And feeling, if there's times that you're feeling socially isolated and not able to interact with people, can be very difficult and straining on all of us, including our children. Sometimes we see during pandemic economic factors and other factors such as increased substance abuse. Sometimes parents are stressed out and there's increased use of substances, and that can impact children. We also see more stressors in the home when family are home and not getting out, and there's economic challenges and things. Sometimes there's increased violence or discord in the family, and that can really impact our children. We need to be aware of that. Some children are dealing with grief, loss of loved ones, and being away from friends and people who they may have lost or lost contact with. We have to be aware of the impact of social media on children. Too much of that can be worry children, can impact them in negative ways. And so, and there's also inappropriate content and things on the internet. So we have to be very careful about that. Of course, academic challenges are real for children during the pandemic. Most children don't have the same level of support than when they're going to school every day and interacting with their teachers. So that's difficult, particularly kids who need extra attention or support, or the younger children just starting out. So that can be very, very difficult and disrupting. Also, children sometimes when they're going to school is an opportunity for people to see there's something going on, or there's issues at home, or perhaps a child has experienced some kind of abuse or troubles at home, and that's not easily detected in this kind of environment. And the ongoing acute stress is can wear on individuals and children. The next slide, please. And we can see some of these things, some studies, we need more research. Of course, we've only had, this is the second research on it, but there is some research being done the last few months on impacts and what we're seeing on people, and particularly children. And post-traumatic stress disorder is a disorder that when people experience some severe or difficult acute trauma, and it's impacted them so much that they continue to think about it, have nightmares. It impacts how they function in their daily life. And so that can be a factor for children if there are several factors going on with a child. Perhaps there's a loss of a loved one, being isolated, and several things on top of that can be very difficult. We can also see some depression in people, reduced appetites or overeating, loss of sleep, and feeling that your life's not worth living. These kinds of things are very concerning. And of course, anxiety disorders, a lot of stress, a lot of worry, ruminating about what's going to happen in the world. So these are very difficult times for children and adults. The next slide. So these are some things that we can do to support our children and support each other. It's very important that we talk about how are we feeling, how are things affecting us, and allow children to just talk about that from their experiences and in a factual way. We don't want to create a lot of worry or too many things that make them think that things aren't going to be okay. We need to support them, encourage them, but allow them just to talk about that and pick a good time to do that, and not a time when they're engaged in something else, or there's some kind of discord going on. Pick a good time that we're together to talk about things and validate how children are feeling and what their feelings are. It's so important that many of us know after you talk to a friend and they encourage you and allow you to talk about your feelings, how validating that can be. Very important that we spend time together with those we can interact with. It's an opportunity to do some things that we haven't had time for, and family games and family activities, and talking with our family, learn about family history and other things. So this can be a good time and an opportunity to do that. Don't be afraid to get outside. Of course, people get outside, and if you're close with with other people, you want to continue to use your mask and do all the things that we are recommended by our officials. But it's good to get outside and get fresh air. And we find many people say once they get out, it kind of is uplifting for them. Spend time with people who are positive and lift you up, and help you to feel connected and positive, and avoid situations for people who there's a lot of negativity. It's real important that we safeguard our mental health in that way, and keep all the healthy routines of getting enough sleep and eating healthy and avoiding tobacco and substance abuse. All of these things are very important to do, because as a doctor mentioned previously, we need to keep our immune system healthy and prepared so that when things come our way, we're in a better situation to deal with those things. And physical and mental health go together. They're not separate. They go together. Some other things, it's important that we limit media exposure, especially things that are negative or too much, things that are going on that are adult content, or things that children don't need to worry about. Allow kids to be kids, and allow us to make those decisions and think about those things. Make time to relax and recharge for yourself and your children. It's so important. It puts us in a good situation to be prepared to handle all the things we need to do. Develop strategies for emotional regulation and mindfulness and things like that. Then there's a lot of skills we can learn so that we can find ways to ground ourselves and relax ourselves and be our best selves. Sometimes we need to seek help and seek counseling. And we always recommend evidence-based practices, things like cognitive behavioral therapy and other EBPs, we call them, that we know research has shown that they're effective for children and adults. Also, reach out to our clergy and our spiritual advisors. Many of us have various faith communities, and those can be very, very important to us at this time. Remember, our spiritual health matters too. And please, caregivers have to take care of ourselves. You cannot take care of someone else unless you are taking care of yourself first. It's very important.
Katie, the next piece of this is really, really important. And in the interest of time, I'd like to invite you to come back next week and let's go over this in more detail. Can you now give us your contact information in the event that people in this next week need to give you a call, or someone at the office a call, and knowing that we'll come back next week and get into detail on when people can get help? If we can just go to that next slide and make sure that people know how to contact you on a regular basis.
Certainly, yes, I appreciate that. I'll certainly do that next week. I can continue to share a few additional things. But yes, you certainly can contact us. This is our 24-hour number, 810-257-3740. My number is 810-869-8111 if you need to contact me. And my email is kbaxter@genhs.org. And I can type that in the chat. Thank you so much for having me.
Well, thank you so much. This is really important, and we don't want to have to go over it too fast, Katie, because I think when we talk next week, the listeners will really understand how critically important it is. And I know you'll have some additional things that you can add to that. So thank you so much, and we'll look forward to extending this conversation next week. One of the things we wanted to share is when you talked about getting out and getting some exercise. Just to emphasize that the Greater Flint Health Coalition has their Fall for Fitness activity. That's one way for us to get up and get out. So we wanted to include this as a part of this conversation. Just 1,000 minutes in the month of October. We're 16 days in now. You got a few more days to get some exercise in and be a part of this wonderful initiative sponsored by the Greater Flint Health Coalition and their Commit to Fit initiative. As we're thinking about this, we know that even the earlier conversation with the community schools, some things that are happening out of the governor's office, but we want to hear now from Gary Jones, who is our community affairs representative for the city of Flint. And he's going to come and share with us some updates. And I want you to remember, you can put your questions in the Q&A so that they can be responded to by our panelists. So Gary, what are the key things you want us to know about today?
Okay, the first thing I want to do is make sure I keep my computer on. That seems to be the theme of the day here. Okay, so I think we're all set. So total confirmed cases now for COVID-19 for the state of Michigan is 141,091, and total COVID-19 related deaths are now 6,973. A total of recovered COVID-19 cases as of October 9th are 104,271. And as a note, recovered is defined as the number of persons with a confirmed COVID-19 diagnosis who are alive 30 days post-onset. Recently, Governor Whitmer established emergency rules to provide workers compensation for frontline healthcare workers affected by COVID-19. So the governor signed an emergency rule to clarify workers' compensation coverage for healthcare employees and first responders who have tested positive for COVID-19. Also, Midwest governors Whitmer, Evers, and Waltz urged the president and Congress to put partisanship aside and pass COVID-19 relief bill. So the governors of Michigan, Wisconsin, and Minnesota sent a letter to the president, Senate Majority Leader, House Speaker Nancy Pelosi, Senate Democratic Leader Chuck Schumer, and House Republican Leader Kevin McCarthy, urging them to pass a bipartisan relief bill that provides much needed support to states as the U.S. continues to fight the COVID-19 pandemic. The governor stressed the need for federal support for states, testing, as well as PPE. Also, in case you missed it, the publication Political published an article in regards to which states had the best pandemic response. The success of the Michigan Coronavirus Task Force on Racial Disparities was highlighted in this October 14 Political article that analyzed states' responses to the COVID-19 pandemic in 2020. Also, Governor Whitmer took action to protect workers and keep workplaces safe from COVID-19 through the Michigan Occupational Safety and Health Administration, or MIOSHA, within the Michigan Department of Labor and Economic Opportunity, as one of the first state OSHA programs to promulgate rules which clarify the safety requirements employers must follow to protect their employees from COVID-19. The governor also called for an extended 2021 health insurance marketplace open enrollment period. So the governor, as well as the Michigan Department of Insurance and Financial Services, called on the Trump administration to extend the 2021 health insurance marketplace open enrollment period to give more time to the thousands of Michiganders who lost health insurance during COVID-19. And also, MDHHS issued emergency orders updating gathering definitions, capacity restrictions, mask requirements, and worker protections in order to help slow the spread of COVID-19 and protect the health and safety of Michiganders. MDHHS Director Robert Gordon issued this emergency order in order to restrict gathering sizes, require face coverings in public spaces and childcare facilities, placing capacity limitations on stores, bars, and other public venues, and providing for safer workplaces. And just as a reminder to everyone, michigan.gov/coronavirus is still the best website to keep updated with everything.
Thank you so much, Gary. And we are just about out of time for today. Appreciate you so much. Just a few quick reminders. We've heard over and over again today that we need to maintain our health and personal protection. So we want to encourage you to continue to do that. We thank you today for tuning into the webinar for today and participating in our sessions. Remember, the community health workers, you can get those CEUs. And yes, we are working on that for social workers. We want to remind you that you can like us on Facebook, and you can subscribe to our YouTube channel. And for any information you might need, and email us at info@healthyflint.org and call us at 810-835-2130. Again, this is an opportunity for you to share with us. As you've noticed, we try to make sure we respond to the information you put in the evaluation for us, so it will pop up immediately following, at least within the next hour of this webinar, so that we can hear from you. We'd like to invite you to join us next week for our next webinar, October 16th, number 30, it won't be October 16th, today is October 16th, but join us next week for our 32nd webinar. And again, visit us at www.hfrcc.org for more details. So happy that you joined us today, and we look forward to you being with us again on next week. Thank you all for joining us.